Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at some benign findings. So the benign findings, and this is with respect to a newborn. So here the first one is the erythema toxicum. So erythema toxicum. So this erythema toxicum is a small white papules or an erythematous base that usually presents on the face, trunk or the extremities. So face, trunk or the extremities, and they contain the eosinophils. So E for erythema toxicum and E for eosinophils. So they contain the eosinophils and may persist for about a week. Next is the Mongolian spots. So I'll be highlighting only a few important points. So this Mongolian spots is a slate blue demarcated area of pigmentation over the buttocks on the back. So it is an area present in the buttocks, or it may be also seen in terms of the back. And it is also known as the dermal melanocytosis. So it is aka the dermal melanocytosis. Next, moving on, the other findings to name, it includes a pustular melanosis. So pustular melanosis. So this pustular melanosis, it is a benign lesion seen predominantly in the black neonates. So it is seen in black neonates, and this continued melanosis, it contains the neutrophils, and it is present in birth as a vesicular papular eruption around the chin, neck, back, extremities, as well as it can be present in the palms as well as the soles. Then moving on to the sebaceous hyperplasia. Next one, we are discussing the sebaceous hyperplasia. So the sebaceous hyperplasia is a white yellow papule on the nose of a newborn due to hyperplastic sebaceous glands. So it is a hyperplastic sebaceous glands. Next, moving on, the next finding will be the milia. So milia is a pearly white opalescent epidermal inclusion cyst which is usually over the face. So it is mainly found in the face. It is a pearly opalescent white epidermal inclusion. Next, we move on to the Epstein pulse. Epstein pulse. The Epstein pulse nest of the epithelial cells. They appear as white yellowish spots on the hard palate. So it is white or yellowish. It is present on the hard palate, and it usually resolves by 3 months. So it resolves by 3 months. Next is the cutis marmorata. So there is cutis marmorata. So cutis marmorata is a transient lacy reticular vascular pattern of skin. It is caused due to the exaggerated physiological vasomotor response on the exposure to the low environmental temperature. So caused due to decrease in the temperature. Then we also have the suckling blisters. Then comes the salmon patch. So the salmon patch, this is aka the nevus simplex, and it is a small ill-defined pink colored macules. It's commonly seen over the glabella, eyelids, upper lid as well as the nuchal area. and it develops due to the vascular ectasia. Next, there can also be the presence of the harlequin color change. So there's a Harley Queen color change. So it is a transient, well demarcated color change with one half of the body displaying erythema and the other half pallor. So there is half erythema and there is half of pallor. So half erythema and half pallor usually occurs between 2 to 5 days of age. Next are the findings. It includes the vaginal bleeding in a newborn. These are some normal findings. So there can be vaginal bleed in a newborn, and this can occur up to 2 to 3 days of age and enlarged and secretion of the breast in both sexes. Next is presence of hymental tags. Then comes a physiological phimosis, conjunctival hemorrhage, as well as peeling of skin. Peeling of the skin.